Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes. Today we are going to do a writing task which is going to be beneficial both for doctors and both for nurses as well. So this is a kind of a task that obviously can pop up whether you are a doctor or you are a nurse. The first thing I always tell you to see in the task is to whom we are writing the letter. So in this case, we are writing the letter to Dr. Shaw. Who is Dr. Shah? So let me check what is the designation. So I need to know मैं letter किसको लिख रहा हूँ. So it doesn't mean that I want to know the name of the person. I want to know the designation. So the designation is consultant obstetrician. So today my topic is going to be gynae related. I should obviously know that obstetrician is going to work for this thing. So that is what my topic would be today. So let me see. And after this, when I get to know that this is the person whom I am writing the letter, consultant obstetrician, the second thing I want to know is today visit. There can be number of visits. In this case, we don't know whether these are visits or what, because it has been given in the form of treatment record. So I don't know whether these are visits or these are just dates. I told you in the previous letter as well, when you do not know whether it is a visit or it is a date, so always mention dates. Like if I have to write this thing, so I will say on 21st April 2009, the patient was diagnosed with dysmenorrhea and menorrhagia. So what I want to say, I will write the same line. On 21st April 2009, patient was diagnosed with, so the patient was diagnosed with menorrhagia and dysmenorrhea. So what I am doing basically is, if you all understand, that I am not trying to write anything. I'm just trying to write whatever has been given. I'm not saying on first visit, on second visit. So dates does not always mean visits. So I will simply write on 21st April 2009, the patient was diagnosed with menorrhea and dysmenorrhea. Full stop. Along with that, the patient had menstrual bleeding from 10 days. So means I won't say ki on next visit. So I would say after 2 years, the medication was seized. So I will tell you about this, but I'm just telling you about the letter, that dates doesn't always means a visit letter. So this was the first thing why this letter is very special, to tell you that dates always do not mean that it is a visit letter. Second thing, once you know that you are writing to Dr. Shaw, now you know that she or he is an obstetrician. So now Dr. Miriam Shah. So again, I don't know whether she's a girl or a boy, but again, in doctor's case, I won't be confused, because when I will mention the address, I will say Dr. Miriam Shah, consultant obstetrician. So that is how I will start the letter. Obstetrician will write complete, whatever the spellings are. Then I will say Royal Hospital. Then I will say Lowtown. Then I will write today's date. Today's date is 6th April 2019. Then I will write regarding the dear Dr. Shah. Then I will write regarding. So this is the pattern of OET letter writing. Then I will write Mrs. OIivia Hawthrone, O capital. And then I will mention the age 30 or whatever the age is. I'm not quite sure. So that is how you write the pattern. So once you are done with it, you have written everything. So Dr. Miriam Shah, I know she is a consultant obstetrician. Now, because I have written it myself, so I will always remember the designation. I will remember the address, Royal Hospital, Lowtown, this and this. Then I will mention the date. Then it would be followed by Dear Dr. Shah. Then it would be followed by regarding. So now after writing these things, one line space, and then I will write this letter is being written. So the today visit is the most important visit to know about the purpose, because we are referring a patient to any doctor. Obviously that today there must be some trouble. So I'm just going to read about today. So let's read about today. Today, removal of IUD unsuccessful. So it says that IUD has been unsuccessful, attempted for 15 minutes, intrauterine device, its removal has been unsuccessful. This was attempted for 15 minutes, unable to locate strings. Patient cannot recall last time strings located. Pregnancy test is negative. So when we have not been able to find IUD, so that means that intrauterine device has either shifted within the body or maybe has fallen out of the body. So that is why we need to refer the patient to obstetrician or gynecologist for further investigation. So now the purpose is quite clear to me. If I have to write the purpose, so I can simply write, I will take this opportunity to write over here. So now I can make it very simple. This letter is being written only from the last visit. You can make the first paragraph, and first paragraph is the most important paragraph. This letter is being written regarding Mrs. Hawthrone. So that is the name of the patient in this letter that would be given on the first page. Mrs. Hawthrone, who has presented today. I will always write in the present. So has plus third form. This is my present perfect. Present perfect means has plus third form. Who has presented today for removal of intrauterine device, but it is unsuccessful. Write very brief. Don't explain everything in the first paragraph, because you know the last paragraph, today visit, is also going to be the same. So try to write less in the first paragraph. So it seems that IUD has either shifted. That means we are talking about that either this device, intrauterine device, has shifted within the body or it has fallen out. So these are the best words you can write, either and or. Whenever you are not sure, this question mark, this slash, this means there is a probability. Probability means either or, ya to ye, ya to wo. So this letter is being written regarding Mrs. Hawthrone, who has presented today for the removal of intrauterine device. So I can put a slash in between, that will look all right. Intrauterine device, but it is unsuccessful. It is not very important, this slash, but I feel so. Otherwise, it would be given in the question paper anyhow. So I will take it accordingly. So intrauterine device, but it is unsuccessful. It seems that IUD has either shifted or fallen out. Therefore, she needs your expertise and an ultrasound So therefore, or otherwise say, therefore she needs an ultrasound and further investigations. As soon as I start finding any mistake in myself, like in this, for further investigation plus ultrasound. So she needs an ultrasound and further investigations. So she is being referred under your expertise. So I make it simple that is why she is being referred under your expertise, because you are, so whether you are a doctor or you are a nurse, this kind of letter can come. So basically you are writing to your senior surgeon about a patient who came to you for the removal of IUD, but it is unsuccessful. So don't write everything attempted for 15 minutes. This we will write in the last paragraph. So main purpose, it seems means there is a probability because question mark is given. So you can also say it is suspected that. If you want to say, you can say it is suspected that. It has either suspected. Suspected means there is a probability. So these are the best ways of writing. So please try to remember these things and try to write it this way. Now this letter becomes very simple except data selection. Now data selection is the only problem that can, that can cause harm to our OET test. Otherwise, if you have written the first paragraph well, if your grammar is good, then it is 100% that you will pass. If your grammar is good, your first paragraph is good, it is 100% that you will pass. So now data selection is the third major thing. Apart from grammar, and first paragraph. First para, grammar and data selection. These are the three major pillars of writing. So now this is my concern that I have to restrict this letter in from 200 to 210. So this is what I want to achieve now from this letter. Let's see. So Mrs. Hawthrone is a patient at your practice where you are a nurse. She has come to you, have her IUD removed. That we already know. She has presented for IUD removal, but it has been unsuccessful. The name is OIivia Hawthrone that we have already used. She's 40 years old. So aged, I have to mention as 40 rather than 30. So I will mention here aged 40. Yeah. So it comes in the same line like this. Okay. So now let us select now we know the purpose. The purpose is ultrasound. So always keep this purpose in mind. That is what will help you in the data selection. Purpose is ultrasound for IUD. These are the two keywords, ultrasound, IUD. So apart from this, any data is kind of unimportant, insignificant. So let's see. 3140 doesn't matter. Married with 2 sons does not matter. Non-smoker, social drinker doesn't matter. Parkinson's disease does not matter. 3 pregnancies, 2 live children does not matter. DVT does not matter. Iron deficiency anemia, I'm not quite sure, but maybe because she needs an ultrasound, she does not need any operation at the moment. I don't think so. Menorrhagia and dysmenorrhea diagnosed. Yes or no, I'm not quite sure, but again, can be yes or no, but at the moment, no. Then going further, 3rd degree perineal tear, not required. Elective C-section, not required. So I don't require any of the data. Medications, warfarin, ferrous sulfate, not required as such at the moment. Reason for presenting, I know from the last visit, removal of IUD as currently ineffective. So that is the reason that it is currently ineffective for menorrhagia and dysmenorrhea. Now this becomes important. So out of the history I have left, this is important now, and this is important now. Because I am concerned with IUD, and IUD is ineffective for menorrhagia. That means for menorrhagia and dysmenorrhea, IUD was inserted. So for these two things, IUD was inserted, which is currently ineffective. So that is the main reason. So I have to say this is important for me. So when I go to this letter, again, it is a treatment record. So again, it is a medical history. The thing that was given here, again, is given here. So again, DVT, I do not need. Menorrhagia and dysmenorrhea, now I know I need it. So this is my second paragraph. So now while writing the second paragraph, I will write on 21st April 2009, menorrhea and dysmenorrhea were, only the word I have to put, were diagnosed. That's it. Were diagnosed, full stop. Full stop. Then I will say, along with that, she had been having menstrual bleeding for 10 days. So when I am writing ing, that means she was having, but when it comes with time, so it becomes had been having. Let me tell you in a better way. So this is the rule of grammar. I'm just going to take you to an empty slide so that you all can understand. Just maintain the focus. You will learn a lot of things from this letter. I know it is difficult to listen to, but you learn a lot of things. That is what OET is all about. Your teacher and you, that is me and you. We all need to have patience. So now the second paragraph. Second paragraph, Miss Hawthrone. So I won't write this and this. Maximum I can write she has 2 children, but again, this will automatically come. Mrs. Hawthrone. Sorry, second. Mrs. Hawthrone, I don't need. On 21st April. So I did not need anything. 2009. She presented, or I can write here, Mrs. Hawthrone presented with Yeah, sorry, was diagnosed with. Sorry, she did not mention Simta was diagnosed with menorrhagia and dysmenorrhea. First stop. Along with that, don't make any sentence complex. Just stop whenever you feel that line is long. So you say along with that, full stop. Along with that, she was having menstrual bleeding. But now I want to say for 10 days. As soon as I put the timing over here, I have to convert this was into had been. That is past perfect continuous. So this is what will fetch you marks. So along with that, she had been having menstrual bleeding for 10 days. Let's see what are the other things that is given. Now let's go back to the letter. So Cerazette was prescribed. Chaliye. So let us copy paste over here. I'm just going to copy paste over here to make it simple. So sorry, it will look little bit untidy, but it would be fruitful to write here. So I'm just going to take it up as I can. So yeah, here we are. Menstrual bleeding for 10 days. Comma, so. There should be a comma before the connector, before so. So Cerazette was prescribed. Full stop. Now this is a big line. I have written it until now. So Cerazette was prescribed. So after 2 years, that is 2009 to 2011. So after 2 years, write it very nicely. Your word count, you have to save your word count in social history and medical history of this letter. So we have saved all the word count by not writing the medical history and social history. Let me show you. So we have not mentioned any of these points. This is where I saved my data. There was nothing important. 2 sons, this. Because if I talk about 2 sons, so here child 1, here child 2. So again, I don't have to mention it here. She is having 2 sons. And also for the obstetrician who's gonna perform ultrasound, it is not important to know how many sons does she have. So that is why that is where your word count goes out of control when you try to mention these things. So you need to be careful. And how would you remember that? Always keep ultrasound in mind. That is the only thing you want from obstetrician. So now you are just telling bit of story after 2 years. Cerazette was seized. So the only word you are putting is was. You are making a passive voice. Cerazette was seized to conceive child 1. So I'm just telling the history. Then after, in 2009, now you don't have to mention everything like dates. So you can simply say in 2012, menorrhagia and dysmenorrhea goat worse. So the only word you are putting in here is goat. Only this word, menorrhagia and dysmenorrhea, worse ho gaya, second form, past, goat worse, then pre-pregnancy. So again, so combined pill Cerazette was prescribed. So combined pill Cerazette was prescribed. Again, nothing, no grammar. If you will check this thing, if you will see this paragraph, Hawthrone was diagnosed, was plus third form, then had been having menstrual bleeding for this. Then again, Cerazette was prescribed, passive voice again by us, was diagnosed by us, was prescribed. After 2 years, medication was seized basically by us, by hospital. So was plus third form. She got this. So again, Caesar was prescribed. So again, a passive voice was plus third form. This is how simple oetegram is. Was plus third form. Anything that is done by the hospital, that is by you, is a passive voice. This was diagnosed. Cerazette was prescribed. It was stopped. It was again, then Cerazette was prescribed. So but then this medication, so combined pill Cerazette was also stopped to conceive child 2 in 2013. So that is how you write. Now, see, look at my letter. I don't know how difficult the question paper was, but my examiner is going to get this letter. My examiner will get my answer sheet and how simple it is. This letter is being written regarding Mrs. Hawthrone, who has presented today for removal of IUD, but it is unsuccessful. It is suspected that IUD has either shifted or fallen out. So that's why your expertise is required, doctor. So doctor, I'm writing you because IUD, I don't know where it is and we have not been able to find it. So it has shifted or fallen out. So let me tell you about Hawthrone, doctor, that on 21st April, Mrs. Hawthrone was diagnosed with this. So then she stopped the medication. Then again, she took some medication. Then she again stopped the medication. But what happened after 2013 is that menorrhagia returned with menstrual cycle. So that is why IUD was inserted. So there was menorrhagia that returned with menstrual cycle. So that was the problem that happened. So the problem of heavy bleeding came again. So that is, I think that is what menorrhagia is. So again, I don't have much knowledge about these things, but again, I know OET only by grammar. So I write what is written. So I don't need knowledge even. But if I have, that is a plus point. Menorrhagia, I think there is excessive loss of blood, but we will discuss that later on. So right now I'm concerned about this OET part. So only grammar. So now I have completed all these things in just 2 paragraphs. So that is where I save my data. Then I hope this, I wish this date would have been clear, but I'm taking it as on in 2015. In 2015, because this date is not readable, that's why in 2015, that is after 2 years, 2013, after 2015. So after the birth of the second child in 2015, menorrhagia returned. The only thing I do is making my tenses. So this is something that returned automatically. It is an active voice. That is why I am not putting was. If I write menorrhagia was returned, then it becomes a passive voice. अगर मैं ऐसा लिखता हूं menorrhagia was returned, तो ये पैसिव वॉइस बन जाता है. मेनोरेजिया वाज रिटर्न, दैट मींस इट इज डन बाय अस, but it is not done by us. It is an automatic process. That is never put, that is why I never put was. So what is active? Whatever happens by itself, just write second form. Menorrhagia returned with menstrual cycle. So again we are writing so again and again. So you can replace this connector by the word for which. For which. Now, this is the main thing, my topic, IUD, Mirena, coil was inserted. Again, this was done by the hospital. This was done by the hospital. So my was plus third form is back. So in 2015, this was inserted. So now my topic is going all well, everything smooth and easy. Coming on to this part now in 2018. So after the insertion of 3 years, menorrhagia improved. There was no problem, no menstrual bleeding. But again, whenever there are positive things, I don't have to mention much. So it all got better, that is fine. What is happening is just 4 days back. So the story is going well. The story is going well, whatever we said. Okay. So this is what we had written until now. Please focus and maintain the focus. It's very important for us, and especially for the students who are taking exam tomorrow. Wish you all the luck. But at the same time, please listen to this letter. This is a very nice letter to learn. So yeah. Okay. Yeah. So this is what is going on until now. So this was inserted in 2015. Now the main story. Today is 6th and she returned on 2nd. However, this is where I fetch marks 4 days back. 6 minus 2, 4. 4 days back, she again complained of menstrual spotting from 3 months. Simple. She complained of this. She was experiencing, again nothing, just was were ing. She was experiencing menorrhagia and dysmenorrhea. These are the two main things. So basically what is happening, that IUD was inserted to control these two things, menorrhagia and dysmenorrhea. But both of these things are currently not being controlled. That is why we are saying this device is effective. Therefore, this is the main story. Therefore, she was suggested to get her to get IUD removed. So that was the suggestion that was given, that please get IUD removed. So she was suggested to get IUD removed. This is the main thing that is going on. So don't mention everything. That you can mention increased hairiness, greasiness. You can talk about these things. But if you want to stay to the topic and save your words, just mention this much. So this is the main thing, that removal was suggested. So what is happening is, today, now I will explain the story. Today she has presented, and for the removal of IUD, but it has been unsuccessful even after attempting for 15 minutes. That is what I want to say. That is how I write better. That but it has been unsuccessful even after attempting for 15 minutes. The patient, always write the patient if you want to fetch marks. The patient. So the word is very important. The patient has reported. So now you can say the patient has informed or reported that she cannot recall the last time when strings were located. So even she doesn't know. So even the patient is unaware. So she cannot recall, she doesn't remember, and we are unable to find her. So therefore, she has, therefore, it has been suspected we have used. So we can say it seems, whatever you have used, vice versa. Or you can say it appears. Then, or you can say, therefore, it is suspected or it seems that IUD has either shifted. So these are the only words which will repeat. I will try to change these words, but this letter, again, these words are very simple, so I can't change it much. Otherwise, I would have tried some kind of paraphrasing, but it is not possible in this because it's straight. So it is suspected that IUD has either shifted or fallen out. Now simple, for which further investigations, including ultrasound, are required. So now I have mentioned these are the things which are required. Further investigations, S, that is why are required. For which further investigation, ultrasound are required. Yeah, we can, or you can say fallen out. So for the, yeah, you can say for which, yeah, it's going fine. Why should I change it? For which further investigation and ultrasound are required. Again, I don't want to use therefore 2 times. That is what is causing me trouble. That is why I'm thinking so much. So I would say, where things were located, it is suspected that therefore your expertise is highly required and would be highly appreciated. Again, there is no problem that you don't have to overthink like me because I'm teaching. That's why I have to think. Otherwise, you can simply say, if you write therefore over here, therefore, it is suspected that if you write it here, then you say simply, so I require your expertise in this case would be highly appreciated. So you can simply complete this sentence. Your expertise in this case would be highly appreciated. That's it. Last line, should you require further information, feel free to contact us. Completion of letter to contact us. Yours, the name of the doctor is given. So yours, when the name is given, you say sincerely, otherwise faithfully. So the name of doctor is given. So that is why I'm using yours sincerely. Yours sincerely, registered nurse. If you are a doctor, then you say registered doctor. That is how you end the letter. So this is a complete step-by-step guide. And if you will count the words, still I would say you would be thinking that we have left so much of data. So word counts will not be complete, but let us count the words. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 20 words in word line. 1, 2, 2.5, 3, 4, 5, 6, 7, 8, 9, 10. 10 into 20, exactly 200. So this letter is a precise letter. So the problem when you attempt the letter is that you try to write these things which are unimportant. You try to write this point which is not important because it improved. This person, the obstetrician, is not concerned whether it is improved or not. He or she wants to know about the problem. So Dr. Shah knows the problem now that spotting has returned. And she is again experiencing this problem. And for these problems only, IUD was inserted. So now it's not working. But the main thing is that we have not been able to find it. So that is why ultrasound is required, and that is what is the whole purpose. So it does not make my letter, effective, and data selection also effective, but also at the same times, I become a kind of a person, a candidate who wants to tell everyone that OET is the easiest test of the world, because any line which is difficult is exactly the same line which you can avoid to write. We get entrapped with OET when we try to write the lines which are not important. जब भी आप ऐसी लाइंस को लिखने की कोशिश करोगे जो important नहीं है, that is where your grammar would be hurt. That is where things will become complex. So always write OET in the easiest way and write only the words and lines which are important. I hope you all have understood. Please listen to this recording 2 times, 3 times, whatever you like. But please master this thing if you want to score 400 or 450. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. Call us for the best OET coaching. And for any doubt, please leave your remark on the comment box. We will surely reply. You leave your query as well. Thank you.